Do parents matter? This is what Harvard's Sarah and Robert LeVine ask in their book. Spoiler alert, here's their answer. Parental practices vary much too widely across cultures for us to accept uncritically the supposition that the mental health of American children is being put at risk by insensitive infant care. So let's translate that from Academese. Parents are overrated. Before I tell you what I think of the LeVine's argument, let's talk about some of the things I liked in the book. The book does do a good job showing a wide range of child-rearing practices throughout the world. Here are some examples that were very interesting. In Kenya, the LeVines observed that when a baby is 6 months old, Gusii mothers begin avoiding eye contact with their children, as well as avoiding responding to non-distressed baby babble. But they also still responded quickly to cries of distress, and they maintained skin-to-skin contact. In Nigeria, the LeVines observed that Hausa Fulani communities practiced a code of kin avoidance, with mothers not speaking their oldest child's name and avoiding eye contact. However, mothers were also quick to respond to infant signs of distress. Children could also be sent to live with kin in a different village at a young age. The LeVines argued that despite what might seem like distant parenting approaches to the contemporary Western eye, children seem to grow up just fine. Number 2, I also enjoyed the discussion of parenting trends, especially the examination of early 20th century fears of contagion, which led doctors to caution parents against physically touching their babies, like this gem. Infants should be kissed, if at all, upon the cheek or forehead, but the less even of this, the better. Number 3, the LeVines also explore things that other cultures do that many Americans are afraid of, like early potty training or co-sleeping, and explain how these fears are completely overblown. The book is full of interesting tidbits, but I have a few quibbles with its overall framing. The first quibble is that American child-rearing is, from the LeVines' perspective, hyper-focused on neurological stimulation and early verbal abilities. I understand that there are parents who have been angling from before birth on how to get their kid into that fancy private preschool. This is probably the approach that the LeVines have been most exposed to because they teach at Harvard. But this assumption flattens the US parenting landscape. Come visit rural America. We've got 8-year-olds driving razors around town. The hyper-competitive Ivy League parents should take the LeVines' advice and chill out, as well as stop trying to build their child's self-esteem by cheering every time their child does anything. That's a welcome message I can support. My second quibble with the framing is that the LeVines seem to conflate elite American competitive hyper-parenting with attachment theory, which is based on the idea that a child's ability to fully engage with the world requires a secure base of attachment with his or her caregiver. Clearly, there are distinctions between hyper-parenting and attachment theory. In fact, parenting inspired by attachment theory actually tries to emulate certain practices of groups like the Gusii and the Hausa, such as on-demand nursing, skin-to-skin contact, and quick responses to a child's discomfort. But the LeVines seem to say that attachment parenting is concerned primarily with face-to-face contact and neurological stimulation. Attachment parenting advocates also don't have a problem with co-sleeping and are more likely to try to potty train their children at a much earlier age, believing both practices facilitate a bond of trust that the father of attachment theory, John Bowlby, advocated. When the LeVines invoke the specter of attachment theory, it's hard to know what they're really talking about. I'm also not sure that American parents can be faulted for being especially concerned about their child getting neurological stimulation, because they lack the same support network of extended family, especially alloparents, and children of all ages to provide baby with a wide range of experiences. In the United States, the burden falls more heavily on parents, generally mothers, to get their child the necessary stimulation that would naturally come in a more communal setting. It's probably true that Bowlby put too much pressure on mothers to be the be-all, end-all of their children's lives, but Do Parents Matter takes the criticism too far by saying parents are overrated. The LeVines unintentionally show the opposite. They show that a child needs not just 1 or 2 adults to meet their needs, but a whole community. And caring for children is skilled work. You see how much skill we've lost by comparing how 5-year-olds in communities around the world can take care of a baby, whereas American 5-year-olds are more likely to... Well, you get the idea. So is it true, as the LeVines contend, that the role of American parents in a child's well-being is grossly exaggerated? I answer an emphatic no. Parents in the US are actually more important given our lonely way of life. If a parent falls by the wayside in this country, it's much harder for someone else to step in. Do parents matter? Yes. And so do alloparents. Grandma, grandpa, uncle, aunt, cousin, neighbor. We need them all. Thanks for watching, dear friends. Make sure to subscribe and like the video to please the Google algorithms. Any good book recommendations? Tweet at me or comment below, and we'll catch you around on the next video.